Hi everybody, so we are looking at the 4 levels of response. The 4 levels of response, we look at AVPU scale. What is the AVPU scale? When we look at vital signs, very often we think of, and we're correct, we think of pulse, we think of breathing, we think of skin colour, but actually the most important vital sign is the level of response. If you find somebody who is alert, we're not going to check their pulse or their temperature. We know they're okay. A on the AVPU scale is giving you an indication that the person is absolutely fine. Okay, so there are 4 levels of response. A stands for alert. If somebody is not alert, it's then that we want to establish what's really going on. So very often, and in most cases, naturally, instinctively, we're just going to talk to them. Are you okay? Are you feeling okay? You don't seem yourself. So you're going to check if the person is not alert. You're going to check if the person is responding to voice. If the person doesn't respond to your voice, you're getting worried. If the casualty doesn't respond to voice, at this point, we are getting concerned and we're going to tap them, touch them, see if they're responding to pain or stimuli. P. So if the casualty is not V on the AVPU scale, we're then going to check if the casualty is responding to pain. And U, if the casualty is not alert and they're not responding to voice and they're not responding to pain, that means your casualty is U, they are unresponsive. Then we go back to treating U, the unresponsive casualty. And we know that if somebody is unresponsive, we need to make sure they have an airway, and then we need to check breathing. And that brings us back to the very beginning then of our primary survey. So the 4 levels of response are A, V, P, and U. To me, they are like really important vital signs, probably the most important initially for first aid responders. Is the casualty alert? If they're not alert, you see if they're responding to your voice. If they're not responding to voice, we're then going to check and see if the casualty is responding to pain or stimuli. And then if they're not alert, if they're not responding to voice, if they're not responding to pain, the casualty is U, unresponsive. 4 levels of response. Enjoy the rest of your course.